game-changing discussions on the big ideas that shape our thinking. This is One-to-One. Previously on One-to-One.
On an average year, maybe about 40, 50 hospitals would come to visit the Federal Medical Center Ebute-Metta. Entire state governments came with their executives, with their legislators, with everybody. The military came, to visit, to look at our best practices, Today, maybe about 150 hospitals are using the same electronic medical records that we designed.
So Dr. Dada, let's talk about the COVID years. You of course, were medical director at FMC Ebute-Metta for 8 years, and you were in post during the COVID years. I mean, COVID, of course, huge socioeconomic phenomenon. It forced leaders to make life and death decisions. I'm interested in you going through that. How did that experience change you as an individual and as a leader?
Yeah, again, I think it's reinforced the need to plan. When COVID was coming, what we saw on TV was a situation in which even the advanced countries were struggling.
Yeah, of course.
You saw people in Italy and then you had this situation where the WHO was counting deaths every day and counting infection and creating a lot of psychological fear. And then, of course, we had a situation in our country where we were totally not prepared, or maybe we underestimated our capacity to actually withstand the scourge.
The health minister might disagree with you. Yeah. He sat in that chair and said to me that we had some preparation coming out of Ebola. But
yes, we had Ebola, but don't forget that the Ebola situation was quite slightly different from the... Yes.
Correct.
The system had dealt with a very contagious, infection previously, which was Ebola.
But not quite at the scale of COVID.
At the scale of COVID.
Do carry on, yes.
And then the truth of the matter was that by the time the system was evaluated, the kind of volume we're talking of, in Ebola, maybe a total of 30 or 20 or 50 people were
Correct.
And it wasn't a respiratory infectious agent like COVID.
Not a pandemic.
And not a pandemic, where everybody virtually was involved. And so,
carry on.
It may be correct to say we had some level of preparation.
It may not be, but carry on.
It may also not be, but for me, there was a lot of fear.
Yes.
And I think our preparation was not, the system was fragile. The system, maybe I should talk not in terms of preparation, but I should talk in terms of the system.
Yes,
our system was very fragile. Yes. Everybody was afraid, that, all right. But the good thing was that by the time the infection was getting to us, the science of it was already reasonably known, Don't forget that WHO initially said, don't wear mask, But we now know that it was actually, the major preventive action actually was the mask.
Mask wearing,
So the science had become a little bit clearer, And then, fortunately for us also, it was a little bit delayed before it got to us. And then the leadership of the health system also provided quite a number of strong leadership.
Correct.
And for me, in my own hospital, from day one, I knew that I needed to prepare my system in such a way that, one, services will still continue to go on, and it's just that we don't keep data in our country. If we keep data, we probably will find out that during COVID years, a lot of people died from other conditions apart from COVID.
Yeah.
But we don't have data. That's because almost all hospitals shut down.
People couldn't get to hospitals. Chronic disease patients died of other.
More patients were going to deliver.
Correct.
Pregnant women, they had nowhere to deliver.
Correct.
Everybody was running away. There was a lot of misinformation. Personally, what I learned was that there was always this need. In fact, it's like a reinforcement of the plan of the need to have a good plan. So one of the things we did amidst all those confusion was to sit down with our team, okay? And then, plan within our hospital what is going to happen when COVID comes, because we knew it was coming. So we agreed on two basic things. We needed to have a COVID treatment center, okay? And then we also needed to ensure that services continued. And that is also sometimes where you need firm leadership and strong leadership. Okay, when we insisted that services was going to continue, there was a lot of pushback from an understandably frightened workforce. Okay, everybody was afraid. People were dying. They didn't even know. Okay, but we insisted and said, look, what we need to do, is to protect you. So we ensured that we had those protective, and then we ensured that our services continued. Okay, and then of course we opened our COVID center very early. All right, and of course we also had the requirements to be able to take care of this, and our COVID to be able to take care of the COVID patients. And our COVID center eventually became very popular, okay, because of the results that we were getting in the COVID center. And so we were then able to manage both situations. Normal services were going on, and then we were able to take care of the COVID. So I can remember that by the time the Federal Ministry of Health sent a team to our institution, they found out that we had one of the highest deliveries in the country, and the reason was obvious. That was because we never closed our delivery room at any point in time. Many of the hospitals had closed, so a lot of patients who had actually had their ANC elsewhere were actually
coming to you.
To us. Okay,
of course.
So lessons learned. Okay, one is to always plan. Okay, two is to depend on science. All right, and three, okay, is always the need to push back on misinformation. Yeah.
Very good.
Those are some of the things I learned from me.
So you've spoken here about fear during the COVID years. The Honourable Commissioner also spoke about public fear and the fragility of systems. He remembers quite distinctly the clanging of oxygen cylinders. Dr. Dada, what frightened you most during COVID?
Institutionally, what frightened me most?
No, what frightened you as an individual?
As an individual?
Most, yes.
I was afraid that I could become infected as a person, as an individual, because I'd made up my mind early that I would be on the front line with my staff. Okay, so it wasn't going to be a situation of I'm sitting in the office and some workers. So it was obvious from the beginning that I was going to take an active part in the care of the COVID patients. And I had my elderly mother at that time when COVID was coming. I thought my house was more secured for her. So I had my elderly mother come over to stay with me. So eventually I had to stay out of the main house. And my own biggest fear as a person was actually getting infected and infecting my mother, who was then a lot more vulnerable.
Of course.
Yeah. So that was my own. Okay, but I can tell you that as soon as, incidentally, I never got COVID throughout. Yeah. As soon as I got a good hang on the correct information about COVID and knew how to protect myself, I was going into the isolation ward every day, and I never got COVID. Sometimes I went in like twice or 3 times a day. Okay. So science, we must all depend on science. Okay. Of course, because it was a novel disease, the science was not strong. Okay. But even then, okay, as the process went on, the science became stronger and stronger. And we could depend on science to get us through. And indeed, eventually, science got us through.
Of course. But of course, Dr. Dada, what is clear is that COVID itself was a crisis of incredible proportions, wasn't it? Internationally, that is what a pandemic is. I'm interested in leadership, leaders like you going through a crisis like that. So in your view, do crises reveal leaders or do they tend to create leaders as we all go through this?
Both. It could reveal leaders and at the same time create leaders.
Which was it in your case? A bit of introspection here, a bit of reflection.
Well, I think it revealed me. Okay. Yeah. It did. Okay, because to my team also, okay, it also shows that, in fact, one of them came, I remember one of them is in the UK now, okay, he sent a message to me after COVID, all right, that it could go through a barbed wire for me, the way I motivated them.
So what did it reveal to you about yourself?
Well, it just brought to the fore again one of the things I'd always known about myself, which was that I was a risk taker. Okay, I take a lot of risk. I take financial risk. I take other risk. Okay, because I could have stayed back. A lot of people, in fact, in where we were located, everybody pushed back against us setting up a COVID center. I stubbornly insisted on setting up a COVID center. Incidentally, one of my staff who supported me in setting that process up, okay, was unconscious in our COVID center for almost 5 days, and eventually he survived it. Yeah. And he says till tomorrow that maybe it was because we needed to get some equipment, we needed to set it up. It was an incredibly difficult time. A lot of people were pushing back. A lot of people were undermining the process because they didn't want the center to be in the hospital. Even the environment, our hosts, they were. In fact, I remember the MD of Nigerian Railway Corporation. Don't forget that when he called me and said that he heard that we're planning to set up a COVID center in our hospital. And I said, yes, we are planning to set up a COVID center. And the analogy I use for him is, look, if you have COVID tomorrow, God forbid, is it not better for you to be with us here where your family can take care of you? And they said, yes. And they never pushed. So, yeah, I think that was something that it's revealed about me, Yeah.
So what was the hardest decision you had to make in those times?
To send patients back when the COVID center was filled up. You had situations where, don't forget also that at that time, we're the only public hospital in Lagos that had our own oxygen plant running. And so you find from 5 a.m., maybe 10, 20, 30 cars, okay, lined up. Right, the Bill and Melinda Gates had not donated the oxygen plants to Lagos State at that time. So you find people coming from this center very close to us, in Mainland Hospital, where they also were involved in COVID, people coming with cylinders, with their vehicles lined up, okay. But we had oxygen that was piped to the wards. And so when you then have people bring in their relatives, and then we could not, there was a limit to the number we could take, and you see the state of those patients, the state of the relatives, and then we had to turn them back. Okay. Of course, we kept opening more and more centers. We kept converting more and more as the disease. Okay, but there's a limit to what we can ordinarily take. So, I think the most difficult decisions in during that period was to send patients who actually needed care back to nowhere. Because, we're not sending them back to it was back to nowhere.
Yes. So leadership, of course, often requires making unpopular decisions. How do you balance compassion with accountability? Think about what you've just told me.
Yeah. For me, usually one of the things I look at is question myself. Am I being fair? Okay. And honestly, most times when I'm able to answer that question as yes, okay, leadership balance with accountability, and I'm making a decision and say, look, is this the best possible decision? Is it a fair decision? Is it the right decision? Okay. Once I'm able to answer that question as yes, okay, even if it's the most difficult of questions, I'm able to sleep. So I try to question myself, self-introspection.
Yes.
All right. And once I do that and I'm satisfied, there have been decisions that I'd made as MD, okay, and I live on the island here, okay, and I'd gotten to, in the night, I'd gotten to like Echo Bridge from my office in the night, and I'd turned back to the office to go and change those decisions. Because I made those decisions at that point, and then I start thinking, is this fair? Is this the right decision? Is it in the best interest of the majority? And I couldn't answer those answers as yes. A number of times, my driver will always say that, and I'll say, go back to the office.
Go back.
And then I'll go and change those decisions. In leadership, sometimes it's really difficult. Accountability, versus it's sometimes very difficult. And so sometimes too, it's not all decisions that a leader makes that is correct. Sometimes a leader may genuinely make the wrong decision. But what is totally bad is when a leader does not make any decision at all.
Yes.
Okay, it's totally bad. Because even if you make the wrong decision, you can learn from it and then make a better decision next time. Okay.
Ultimately, the discussion about institutions and leadership becomes a conversation about the country itself, about Nigeria. And one of the remarkable things about your story is that you didn't transform a hospital abroad. You did it right here in this country. What does that say to you, to us, about Nigeria?
Yeah, that's why I've always said to you that I'm an incredible optimist about our country. I don't believe that there is any challenge that we're facing today that we cannot overcome, that we cannot transform. I just simply think that we need to put people who are knowledgeable. If you remember, we discussed about being knowledgeable. Okay, being knowledgeable, being committed, and being patriotic enough, all right, to be able to look at those problems and design solutions and be able to carry their followers along. Okay, if we are not able to do that, then, all right, our leadership recruitment system is very faulty, Dr. Shitta-Bey. All right, it's based on patronage. Okay, and in every society where you base leadership recruitment on patronage, okay, you are probably going to not get any better results than we're getting. It's not based on competence. Okay. Some people have said it's actually due to the constitution. I'm not talking of the constitution now. I'm talking of the composition of the country. Okay. And that is where things like quota system comes in, things like nepotism, comes in. All right. It's not, the recruitment system is not based on, mostly, it's just based on patronage. I know this person and I think he can do this job. Okay. Changes are not made that way. They don't happen by chance. All right. That's my own belief. Okay. Opportunity may support you, but the most important thing is that you need to do the hard work. And so you're not going to just chance on changes. You have to work for changes. And if you don't put people who can work for changes in positions of authority, then do you expect anything better? It's not by chance. And I think, in my own opinion, that that is the biggest headache we have. And even if you look at the country, you find out that where leadership had made the right call in terms of positioning the right persons to take over the right places, it's obvious. It's obvious. Look around. It's obvious. Okay, knowledgeable people. You can't change a system you don't know. All right.
Indeed.
Yeah. It doesn't mean that you don't have to be for instance, you don't have to be a medical doctor or you don't have to be an engineer to be a minister of works, but you must be knowledgeable.
Yes.
Okay. And you must have the tool. All right. And you must listen. Okay. All right. And you must learn your subject.
Yes.
All right. So that is just basically it. I mean, you watch the debates in the House of Commons and you find out that the secretaries, I mean, those are the ministers, they have good knowledge. Yes, they reel out the data.
Yeah, and they switch for portfolios
and
as well.
They switch portfolios, and then the guy also goes to another section and then learns. But when you are appointed and the only thing you are doing is carrying Babariga and answering honorable minister or honorable commissioner, and you know next to nothing about, you have no plan. Okay, it's only probably in our country that you have government appointees who can talk about the government.
Yes.
Okay, you take them on, they can't talk about the government. They can't talk about their programs. They can't talk about their plans.
Absolutely.
So that is just the problem. It's not in our star. Okay. I think it's just simply in our way.
To what extent do you feel, that this is occurring because we have a followership that will accept it?
Oh, yes, absolutely. Absolutely. It's always said that the followership deserve the leadership that they get. Okay, we have a followership that is too, placid, if you like. Okay, we're not, and again, you may also say that it is because that followership has been popularized, and all of that. Okay, the followership, we're not critical.
Yes.
All right, and we accept mediocrity readily. Okay, and then there are also institutional divisions. We must not forget that. All right, as at the time the British were cobbling the Nigerian states together, okay, their own union, okay, was itself very shaky.
Absolutely.
As at that time.
Yeah, with Ireland.
Exactly. So that should have taught them the lesson that when you cobble things together, sometimes there are inherent centripetal forces within that, whatever you had cobbled together. And I think that's part of the challenges we've had as a country. And if you look at the whole of Europe, all right, in most of the places where there has been cobbling, permit me to use that word, there are challenges. Look at Spain, okay, is it Magister they call them, and the guys in Barcelona, they call them the Catalonians.
The Catalans.
Yes, they're not, okay. Yeah. Yes, if you look at the Walloonians in Belgium and the French and the Germans, they have their issues.
Absolutely.
Okay, you look at the UK, the guys who cobbled us together itself.
Absolutely.
Okay, you are singing the British national anthem. The Welshman will not.
There's England, Scotland, Wales, and Northern Ireland now.
Yeah, so
South is gone.
So sometimes you also need to look at it from the inherent challenges in our foundation. Okay, but I mean, if we have been cobbled together, then we need to then work and ensure that our countries work. And that's one of the things that is very painful. The best of our countries are leaving our countries now. All right. Which means that the best human resources, okay, are going out. The average young person on the road is perpetually looking for a visa to go
to Japa.
Yes, to Japa. Even if it's Japa into poverty, it says to you that at least his children would. And when you get to that level in society, it's people have lost. They have lost hope. Okay, and so what we need to do as elites, and I mean, we can't exonerate ourselves.
Absolutely.
All right, we can't exonerate ourselves. Is for us to rekindle hope in our country, and ensure that we allow things to work. And look, one of the biggest things that we have is our population. You can imagine. All right, it means that there is a huge market for anything that is done. But I mean, people come here, they are more interested about their personal interests, which is the problem. That I mean, there's of this joke that people tell that there is flood on a road, the minister would rather buy a jeep than repair the road. That road. When you make societies good, okay, then you can benefit from it. Your children can benefit from it. Everybody else would benefit from it, And I think, the followership too has its faults. They sell their votes, I mean, that is common knowledge, okay? And At the end of the day, somebody sells his house to become a senator. What do you expect him to do when he gets there? He wants to get the house back.
Yeah.
And so
Absolutely.
it's both a problem of leadership and followership. But we must also not forget the inherent centripetal forces, that the British, and I'm not one of those who would continue to blame the British for everything.
Sure.
Yeah, because really, even if that had happened, we should still be able to manage our own affairs.
Absolutely.
Yeah. Unfortunately, we have not been able to do that, and it's sad.
Absolutely. So, Dr. Dada, I mean, you're obviously still very active. You work very hard in your career, but you still have quite a lot to do. You've still got the fight in you, from what I can see here. So it seems a bit premature to talk about legacy, but I would like to talk about your legacy. After all is said and done, years from now, your career is assessed, or you make an assessment of your own career. What would you most like to be remembered for?
I want to be remembered as a patriotic Nigerian who gave his best when he had the opportunity. For me, that is the most important thing. Okay, I don't want to be remembered for wealth. I don't even have. Okay, I just want people to see me as a true Nigerian who showed this commitment to the country when the country gave him the opportunity. And for me, that is the greatest legacy I want to leave behind.
And what would you say to a young Nigerian doctor or healthcare professional who is contemplating a decision to remain in this country or to go abroad, or even thinking about how they might engage with the rest of their career? What would you say to them?
For those who want to go out, I always have one key thing to say to them, that the grass is always green on the other side. Okay? Unless you move close to the grass. It doesn't also mean that you can't advance your career. Okay? But like we said at the beginning of this program, east or west, home is always the best. There's no question about that.
Absolutely.
For those who want to remain here, my advice is, yes, great decision, but life is in phases, and you must prepare yourself for those phases. Okay, in the early phase, you need to enhance yourself professionally so that you'll be able to render the best possible care. Okay, and that heal people who are healed, they are the most vulnerable part of their lives. Okay, and you then, as a doctor, have a power of life and death over them. There's always the need to use that power in a very responsible manner. Okay, and that includes the fact that you're on your bed at 12 midnight and they call you that a woman is about giving birth. Okay, you cannot afford to abandon that call. All right, so you must act responsibly. And honestly, that is even for all doctors, whether you are staying at home or you are going out of the country.
So, Dr. Dada, if you could share one lesson from your leadership experience over the years to contribute towards the advancement of Nigeria, what would that lesson be?
Honesty of leadership. When the leadership is honest, okay, it generates confidence. Okay, the followers are confident. They will be willing to break through the bricks for you. Okay, and nothing will be impossible.
Dr. Adedamola Dada, thank you for joining us on One-to-One.
Thank you very much. It's been a fantastic day.
Real pleasure. Thank you.